Something new. Something new. Good afternoon. My name is Adrian. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, August the 6th, 2020. Honored to be here today on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Tomorrow, Friday, we'll be providing a written briefing at about 3 o'clock tomorrow with case counts and other relevant information. On Monday in Victoria, we'll be briefing in person at the Press Theatre there. And with that, it's my honor to introduce Dr. Bonnie Henry.
Good afternoon. So for today, we have 47 new cases identified in British Columbia, including one epidemiologically linked case, bringing our total number of people with COVID-19 in BC to 3,881. That includes 1,143 people in Vancouver Coastal Health, 2,045 people in the Fraser Health Region, 146 people who live on the Vancouver Island Health Region, 385 people in Interior Health, 93 people in Northern Health, and 69 who reside outside of Canada. We now have 371 active cases in the province, of whom 11 people are in hospital, 5 of whom are in critical care or ICU. We have no new deaths to report today, and we now have 3,315 people who have recovered. As well, we are following over 1,518 people in all health authorities in BC. So those are people who have had close contact with somebody who's tested positive for COVID-19 and are in isolation and being monitored by public health. We have 2 new healthcare outbreaks in the Vancouver Coastal Health Region. One of them is at the Richmond Lions Manor Long-Term Care Facility, and the other at the Joseph and Rosalie Siegel Family Health Center. Both of these are identified a single case in a healthcare worker, but as you know, even a single case we treat very seriously in our healthcare system, and Vancouver Coastal outbreak teams are on site to help investigate and follow up on those cases. That leaves us with 5 active outbreaks now in our healthcare system, 4 of which are in long-term care or assisted living, and 1 now in acute care. We have 666 cases in those outbreaks, 404 residents and 262 staff. We have no new community outbreaks. However, there have been a number of exposure events, and there's also been a number of cases identified on a U.S. registered marine vessel. And we know that they have been tested over the last couple of days, and there have been a number of the 10 crew members who have tested positive. The Public Health Agency and Transport Canada are managing this, along with our local public health and Fraser Health, as well as the BC CDC, and anyone who has been positive is in quarantine, is being monitored, and all of the contacts are being followed up. There is also a community exposure event that Vancouver Coastal Health has posted at Lions Bay Beach Park in Vancouver Coastal. Anybody who was at the park over the week of July 26th, 27th and to 31st is asked to limit your time with others. Monitor yourself carefully for symptoms and contact 811 immediately to get testing if you have any symptoms. The challenges we have all faced as a result of COVID-19 are daunting. And I know for many of us, they are a cause for fear and for anxiety. We know this virus is going to be in our communities for many months to come, and we have adapted our activities. We've done what we can to minimize transmission. We've started to see some increase in cases, but we have put layers of protection in place. We have safely restarted our province in a slow and thoughtful and measured way. We have changed how we work, how we shop. Soon we'll change how our children return to in-class learning, again, based on things that we learned over the past few months. We have shown in British Columbia that we know the precautions we need to take to keep ourselves, our children, our families, and our communities safe. We've shown this. We know that these things work. This is evidenced by the thousands of businesses that have developed their COVID-19 safety plans, as they're required to do. that have reopened and safely increased their interactions with employees and with customers around the province. And yes, we have had some incidences where we've had transmission in these businesses, and we've managed that. When we find people early and we can find their contacts, we can stop those chains of transmission. We know how to do this. We have done it across the province. We have seen this in healthcare, we've seen it in restaurants, we've seen it in some of the events and parties that we've had. We've also seen it in childcare, and we've seen it in how we opened our in-class schools to some children this past June. When faced with setbacks or when faced with clusters and transmission events, we regroup. We come together, we learn, and we've adapted our approach. We've also seen the importance of the contact tracing and the case management and the follow-up that we do in public health to make sure that we can stop those chains of transmission. We keep moving forward with the full resources and support of our public health teams across the province. And we have kept and continue to keep our community transmission in BC low. That is incredibly important, even with the numbers that we have seen in the last week. Obviously, they're higher than I would like to see, but we know where these are happening. We know where these transmission events are happening. And overall, the transmission that we have seen across BC is low, and that's because of all of the measures we have taken collectively. I know for many parents, they are understandably concerned about the impact that's going to happen when their children go back to school in a few weeks. I know also that getting children back into the classroom is essential. It's essential for their emotional and social growth and well-being, as well as for their educational needs, and needs that will keep them as part of the importance that we have in supporting our young people for the next generation. The cost of keeping our schools closed is too high, but we need to understand that all that we are doing to keep our low community transmission enables us to make sure that we can open our schools safely. Like we have done in many locations in many settings, we will be taking many measures to ensure that we reduce risk of transmission in our school settings. We need to look at this as we have every other setting, in every other sector. We know what we need to do. We know those layers of protection will help us. And we need to work together, all of us now, with our schools, our parents and families, our teachers, our school boards, our vice principals and principals, and public health will be here to support you. Opening means increasing interactions. We know that. But we also know that that's backstopped by doing it by layers of protection. And those layers of protection are what we're building into our plans for going back to school. The other thing we need to do is start preparing our own families, our own children now. Use our summer to ensure that we know some of those measures. We know that many children are doing this already. They understand what a safe distance means. When they're on our playgrounds or in summer camps, they're practicing this now. We also need to practice to ensure that we're getting comfortable with wearing masks in those situations where we need that extra layer. So things like on transit, on our school buses, when we're going back and forth to summer camp. Those are things that we need to start doing collectively now. Out of fear and concern, it can be tempting to shut our doors or turn our backs on each other. But that's not what we have been doing in BC. This is, once again, our time to show kindness and compassion, to be there for each other through these challenging days that are lasting far longer than many of us wanted. Any of us wanted. There are over 1,500 people in BC right now across the province who are self-isolating and under active public health monitoring. If somebody you know is self-isolating or from a community where there are a number of cases and where we have outbreaks, and we know that's happening in many places, this is our time to offer them support, not to shun them, not to be afraid, but to make sure they get the help and the services and the care that they need. This virus does not discriminate. We are all being affected by it, all of us, both here in BC, in Canada, and around the world. And we need to come together. No community is immune. We know that COVID-19 is going to be with us for some time to come. And while it remains in BC, we need to keep our transmission low and slow. We need to continue to play safe and stay safe this summer and to prepare for managing in the weeks and months ahead. Let's also continue to support each other with compassion and understanding. As we look to the fall, let's use the fortitude, the resilience that everybody in BC has shown so far to continue to move forward safely. I know we will get through this together. So let's all continue to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. And we say this before, but it's always a good day in BC during this pandemic when no one has passed away from COVID-19, and we've now had, I believe, 6 of those days in a row. We do remember the 195 people, especially and their families, who have passed away from COVID-19 during what's a difficult time for everyone, and our hearts continue to go out to them. What we're seeing in the numbers today is what we've seen in the last week or so, relatively low levels of hospitalizations. Today we had 2 new outbreaks, one in long-term care, and those 2 outbreaks in the healthcare setting are of concern. In each case, they're one staff member. We haven't had outside of one long-term care outbreak in Holy Family, we've had fewer and really very few resident cases in the last month. But as well, we're seeing increases in numbers of cases, and that increasing number of cases, as all of you can see, as all of you see the dashboard every day, are disproportionately in the Fraser Health and the Vancouver Coastal Health Authority after the period of growth in interior health that occurred in the first half in July. And those increase in numbers of cases are obviously of concern, because our success in all that we do, of the things I'm going to report today, of visits in long-term care and on surgeries, or whether it's schooling or the economy or whatever, it depends on us learning from these times, changing our behaviors, and accepting a new normal where we're continuing to able to engage and be happy and enjoy the summer, but have to deal with COVID-19. And I encourage everybody, because I think whatever thing that one would like to do that one can't do right now or can't do as one did before, the likelihood of doing it really depends on us following the advice that Dr. Henry and other public health officials have provided in the recent months. I'm doing 2 updates today. One is on our surgical renewal update. As you know, on May the 7th, we released our commitment to surgical renewal in BC. It's a massive undertaking, the significant changes it require will allow us to keep up with the new demands for surgery and complete the surgeries lost to COVID-19 now within approximately 15 to 22 months. On May 18th, we resumed non-urgent scheduled surgery. The progress shown in our weekly updates and our first monthly report released July 21st is encouraging. It is complex, challenging work, and it continues. The efforts, cooperation, and leadership of doctors, nurses, anesthetists, and all the health sciences professionals and healthcare workers involved in surgeries is making sure that patients get the surgeries they need. Part of this cooperation and leadership is reflected in our ability to use vacation management to reduce the summer slowdown due to planned vacations by 52%. In previous weekly updates, we reported increased surgeries that in part were made possible because of the contribution of these actions that are led, as you know, on a provincial basis by former Fraser Health Authority President Michael Marchbank. And with that, here is our 14th weekly update on the surgical renewal commitment. The number of patients contacted about their surgeries continues to increase and stands at 73,815. This is an increase of 3,237 from July 26th. Between May 18th and August 2nd, we completed 66,212 surgeries. 50,932 were scheduled surgeries, 15,280 were unscheduled or emergency surgeries. That's 12,414 in interior health, 18,392 in Fraser Health, 15,099 in Vancouver Coastal Health, 13,694 in Vancouver Island Health, 3,832 in Northern Health, and 2,781 in the Provincial Health Services Authority. Last week we reported, that's the week leading into July the 26th, we reported 6,379 surgeries completed. As health authorities verify their data after the initial reporting cutoff for our weekly report, we update the previous week's volumes and report the verified total the following week. This means there were an additional 168 surgeries completed between July 20th and 26th for a total of 6,547 surgeries performed that week. This week, 5,450 surgeries have been completed. Again, this is lower than our past weekly numbers as people are starting to take vacation time and we are heading into the BC Day long weekend. As well, Northern Health continues to address mechanical issues, which closed one of their operating rooms and has again reduced the number of surgeries they have performed. This number of surgeries is comparable to previous years and is a continuing success. There's continuing to be work to do, and we want to be straightforward when things are working and not working well, and that's why I've reported on the Northern Health situation, and Michael Marchbank did in our monthly report, and we'll continue to do that in the coming weeks. Equally, I wanted to report on the easing of restrictions for visitors and the visitation policy at long-term care facilities and seniors assisted living facilities. Each week I've been reporting the number of facilities that have a written safety plan in place and that have started to welcome visitors. Health authorities have now reconciled the number of facilities that are required to have a written safety plan in place and have confirmed that the visitor policy applies to 563 facilities. Some facilities are joint facilities, and that's the difference in the numbers. This change in the number of facilities is due to that factor and the duplication of facility names. The ministry will be doing regular, ongoing verification and consultation with health authorities so that these lists remain accurate. I said last week that it was my expectation that all facilities would have a plan in place by this week, and I'm pleased to say that all 563 long-term care and assisted living facilities across BC have a visitation plan in place. That's 97 in Vancouver Coastal Health, 150 in Fraser Health, 134 in Vancouver Island Health, 140 in Interior Health, and 42 in Northern Health. There are a number of facilities that are not accepting visitors at this time. Those include facilities such as Holy Family, Maple Ridge Seniors Village, and Dania Home in Fraser Health, as well as today's announcement around Richmond Lyons Manor that are in outbreak status. 2 long-term care facilities and 2 assisted living facilities in Haida Gwaii are not accepting visitors at this time due to the community outbreak there. I'd like to thank the many people involved in getting these plans in place, the caregivers, the care home operators, administrators, health authority program and licensed staff, Ministry of Health staff, and of course the families and those working directly in care in British Columbia. These plans ensure that all residents and their visitors can see each other in a safe environment. This is tremendous news for everyone. And as you know, in the coming weeks, after the first month of this being in place, we'll do a review to see if we can make further amendments to allow more visits to people in long-term care, which we all know, aside from COVID-19, improves health and well-being of everyone involved. In closing, I note that over the Canada Day weekend, we saw examples of some behavior of people not using their COVID sense that has seen in this period a significant increase in the number of COVID-19 cases. And those of you who watch these things carefully know this is true amongst younger demographics than it had been before. As Dr. Henry has noted, partly in part because of that situation, because of, in some cases, a failure to engage in physical distancing, currently 1,518 British Columbians are self-isolating. And this means not working out, not going out, and causing them and their families and friends significant anxiety. And of course, some of them ultimately got sick. Dr. Henry had amended orders to ensure that these behaviors could not continue to happen. She made sure we limited the behavior that we know makes people sick and, of course, can potentially cause serious illness and death. And those orders have made a positive difference. Since then, new behaviors have emerged in this period. Large parties and private residences. And as we know, large private parties come with huge public consequences. We've seen this. As Dr. Henry has reported, and as the number of cases makes clear, no matter where we break the rules designed to bend the curve, the results can be the same. that COVID-19 can be on the rise, and we don't want to see that. We don't want to see that for our children, for our elders, for anyone. I want to say something to those who organize private parties, to those who are attending them and those who are thinking of other ways to hold large gatherings in the middle of a global pandemic. Enough. That's enough now. Refusing to accept that COVID-19 changes everything, must change everything, puts all of us at risk in all that we aspire to do and to be this summer. The goal of public health officials isn't to ruin anybody's summer or limit their chance to party. That's the work of COVID-19. COVID-19 changes everything for every single one of us. Whether we live in a long-term care home or want to see our friends and families, we can't the way we used to because of COVID-19. Or whether we're younger and want to get out and meet people, let loose and make new friends, we can't the way we used to, and we have to adapt. Let's be clear, it's not the location of the behavior, it's the behavior in the location. Whether it's table hopping or packed houseboats or free-for-all parties in a private residence. Large groups over an extended time period are the biggest welcome mat there is for COVID-19. And it's time to stop putting out that welcome mat. It's time to accept again that COVID-19 is here. It's time to join with all of us, the overwhelming majority of us, and stop the spread. That's enough now. Aujourd'hui, nous annonçons 47 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 3881 cas en Colombie-Britannique. Nous sommes reconnaissants qu'il n'y a eu aucun nouveau décès lié au COVID-19 aujourd'hui. Nous continuons à offrir nos condoléances aux familles et aux amis des 195 personnes décédées du COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Chaque régie de santé compte des patients atteints de COVID-19. 1143 se trouvent à Vancouver Coastal, 2045 à Fraser, 146 sur l'île de Vancouver, 385 dans l'intérieur et 93 au nord. Il y a aussi 69 cas de personnes qui vivent en dehors du Canada. Parmi l'ensemble des cas confirmés de COVID-19, 11 personnes sont actuellement hospitalisées, dont 5 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. And a few reminders to the media before we take questions. Please do press *1 to line up for questions. We will be taking one question and one follow-up at this time. Another reminder to the media, please do keep your phones unmuted. You will not be audible till I call your name. And we begin today with Marcella Bernardo, News 1130. Marcella, go ahead, please.
Hi, thank you, Dr. Henry and Mr. Dix, for taking my questions. Please explain what special measures are now being taken to prevent the spread of the virus in hotspots like Kelowna, where many people from other parts of Canada are still choosing to vacation in large groups.
I'm not sure what you mean. We have special measures in place across the province. So there are things like the order that we put out preventing people from having large numbers of people in rental accommodations. And it's on the owners of those businesses to ensure that those provisions are written into rental agreements, whether it's in a resort, a hotel room, or whether it's a houseboat or something like that. There has been a lot of work in the community in and around Kelowna, but also in other places where people visit regularly to make sure that public health and bylaw officers and local police are making sure that people are adhering to the requirements that we have. And actually, I've been quite impressed by people in those settings, particularly what we've seen in the interior, where people are doing the right thing. So, this is where we have to we have to promote the positive behavior. We are responding. People are making a difference by keeping their numbers small, by keeping those distances, by wearing masks where it's appropriate, and I think it's made a difference.
Do you have a follow-up, Marcella?
Yes, just to clarify, I was under the impression that there was a special team that had been dispatched to the interior now to try to help deal with that as a hotspot, because there are many people flocking to warm places in that region. And also, if you could maybe reiterate if there's been any transmissions yet at summer camps in BC.
So there's no special team. Interior Health is working with the communities. We had a number of conversations with local leaders in communities in the Okanagan, particularly the central Okanagan around Kelowna. So they are working together. But that team model of working together is happening in other places in BC, along Vancouver Island and the Gulf Islands, Whistler, and other places as well. And it really was a wake-up call because of what we had seen during the July 1st long weekend, where people really just wanted to get together. In terms of summer camps, so you will recall, and I know there's been quite a lot of discussion in media about the overnight summer camp in Georgia, in the U.S., where there was quite a lot of transmission. And, you know, these were things that we were considering very early on. All of these decisions that we have made have really come from a point of understanding risk. And so we have not allowed overnight summer camps, similar to the one that had the extended transmission in Georgia in the U.S. So we have not allowed those for those very reasons, that it was a situation where you could not control that type of close contact that people were having. The only summer camp that I'm aware of is there's been one summer camp in Vancouver where one of the instructors in the camp has tested positive, and there's a number of people in isolation, but no other new cases that I'm aware of at this point.
Just very briefly to add to this, I just want to express our appreciation to Mayor Bazaran in Kelowna, and whose team with the City of Kelowna really has done an outstanding job working with Interior Health right at the beginning of when we started to see cases in Interior Health and around Kelowna. The mayor, members of council, the city, all of the leadership of Interior Health, people such as MLA Norm Letnick and others, came together with us and started talking about what needed to be done. And so all the things that you've seen in Kelowna, I think they are a model of how we respond to these questions. But the reaching out by Interior Health officials, the reaching out by the city, the working together of communities has had a positive effect. And we've actually seen in the past couple of weeks a significant decline in active cases in Interior Health, and that's good news. That doesn't mean we're out of the woods or anything's finished now, but I think what you've seen in Interior Health was leadership from people in Interior Health and from people there who started to learn from things that had occurred and made adjustments, and we really appreciate their help.
Thank you. The next question is from Richard Zussman, Global News. Richard, go ahead, please.
Thank you. Dr. Henry, I just want to, one of the quotes you gave in your preamble was the cost of keeping our schools closed is too high. You know, some parents will say that the cost of a child getting sick is far greater than that. And that many parents aren't calling for schools to be closed, they're just calling for other options. So in terms of virtual learning, can you explain what you mean by this cost being too high and speak to those concerns parents have around additional options?
Yeah, so when we look at the in-class school environment and what it offers our children, it is much more than just book learning and instruction that you can get, for example, online or virtual. It is about interacting, about social interacting. It's about growth, emotional and physical and mental health as well. And we know that for many children in this province, they don't have the resources to work virtually. For many children in this province, being at school is where they get health care. It's a safe place for them. It's a place where they can get psychological support, where they may get a meal. So there are many more things associated with our school communities that are incredibly important for child health and growth and for the future of children in our province. So that is what I mean by keeping schools closed has a cost well beyond education. And there are many parents who are absolutely very able to stay home with their children, to have an adequate learning environment. And we've seen that. We've seen some really positive things that have come out of virtual learning environments for some children. But in the overall picture, and we've been looking at this, we've been looking at the downside impacts, the unintended consequences of some of the measures that we've taken. And, you know, closing schools was something that took us it was a decision we made incredibly seriously and thoughtfully. It was something that I have spent a lot of time looking at over the last number of years. And when we developed our plans for pandemic influenza that our response is based on for this pandemic, there were things that we took from previous pandemics, from previous experiences where schools closed for extended periods of time. And we know that the downside impact on some children, particularly those children who were falling behind, is never made up if schools are closed for an extended period. So what we took, the measures that we needed to understand were how severe children are affected by the virus and their role that children play in transmission, both in the school community but in the community at large. And when we closed the schools after March break in March, and went to online learning only, we didn't know the answers to those questions. We know a lot more now, and we minimized the period of time that we kept schools closed. We opened up in June. We opened up for a number of children who had parents who worked in essential services who had no other place to go. And then we opened up in June on a voluntary basis to better understand things as we were gathering more of this evidence. So we now have a very good idea. It's not perfect. There are things that we are still learning, but we know that the severity in children is very mild with this virus, particularly young children. We know that we have not had any children under the age of 19 in this country who have died from this virus, which is a good thing. We have had cases where people have been in hospital or had ICU care, but it's very small numbers, and none here in BC, and we're watching that very carefully. So those are the things that we need to know. We know that children can be asymptomatic, and yes, they can spread it, but they spread it in close environments. And we know that there are measures that we can take, those layers of protection in a school that allows children to be in those environments safely, allows teachers and educators and staff to be in those environments safely. And those are the layers of protection that we will put in place. And we talked about the learning groups, meaning that we will be restricting the numbers of people that you'll be coming in contact with. We'll be adding in reasonable physical distancing that allows for learning in an environment where children can interact with each other without physical touching, with maintaining distance as much as possible, and certainly for older children that's much more feasible. We'll be ensuring that masks are worn where it's appropriate for them to be worn, like on school buses, like in crowded areas and hallways. But we'll be taking other measures to ensure there's increased ventilation in schools, making sure that there's increased opportunities for hand cleaning and hand hygiene. And this is all a learning environment that children and educators and public health will be working on together, and we'll be monitoring and we'll be caring for these communities as we go into the fall. And we do need to remember that school has never been a zero-risk environment in terms of infectious diseases. We get influenza, we get measles, we get respiratory viruses, and the things that we are putting in place will help minimize those as well. And public health has been there. We have school health officers for every school in this province who work with our schools to make sure that if there's a case of measles, if there's a case of meningitis, if there's a case of COVID, we have a plan, we know what to do, we minimize any risk of transmission, and we support people who are infected. So that's what we need to do together to come into the fall. We know that this is important for all of us as a community to support the future of our children.
Do you have a follow-up, Richard?
I do. You mentioned masks there briefly. What are your thoughts on TransLink and BC Transit formally putting their plan in place? And as the thoughts on masks have changed, I know people who listen to these briefings have heard these similar questions, but do you anticipate it could add an extra layer of protection in schools that would make people feel more comfortable being there?
Yeah, so I'm really pleased with TransLink and BC Transit. I think that's excellent. That is an environment where I have said all along, it's hard as ridership increases. It's harder to maintain those physical distances consistently. So I am really pleased that they've come out with this. I think it's a rational and reasonable thing to do, and the way they are implementing it is the philosophy that we've had, where it's not an enforcement model, it's an education and supportive model, and that's where we need to go. And yes, we all need to get used to doing that on transit now, if we can, and make allowances for those small number of people who have challenges with wearing a mask. In schools, as I've said all along, it really is a balancing, and our community transmission is the single most important thing that will protect us from transmission in any other environment. So that's why it's so important for all of us to do what we are doing in BC to keep those numbers low, and that protects us in our schools. There's no evidence that I have seen that the prolonged wearing of a mask by children in classrooms is of benefit, and it makes it a very challenging situation, especially for younger children. But we do know that it's a layer where we can't maintain those distances with larger numbers of people. So it's a balancing again. It's one of those additional layers. Masks will be available in schools for children and for teachers and staff. And of course, teachers need to, the adults in the school setting, one, we're going to be reducing numbers, so parents won't be coming in and out like we have in the past, making sure there's things like staggering of when classes come, when people are being dropped off, so that we can maintain distances in those situations. And some of the outbreaks that we've seen in the States and in Israel, for example, there was a lot of clustering at the beginning of the day, at the end of the day, where families and parents were closer together. So, those are the pressure points that every school is looking at to see how they can tailor the system to make sure that we're not having those group clustering situations, and making sure that we can do those safely. So, it's going to be worked out, and we need to be flexible, and we need to work on it together coming into the fall. And masks will play a part certainly for the adults if they're in close contact with each other, and for those situations where children need them as well.
The next question is from Shannon Waters, BC Today.
Oh, wow, what a treat. Dr. Henry, I'm curious about where the province is rather, when it comes to collecting disaggregated data related to race, and other identifying factors for people in the province. I know that some of that was collected via the survey that circulated in the spring, but I'm wondering if it's being collected now in relation to contact tracing, confirmed cases, et cetera, and if so, when it might be made publicly available.
Yeah, so it is part of our new case reporting. We have not yet started it, with the exception, as we've always collected data on indigeneity, and we've linked it with our First Nations client file, and we've presented some of that data. But the other work that we're doing, so it should, the short answer for the cases right now is it's in the works nationally, and it should be available in the coming weeks. I can't say exactly when. The other part that I think is incredibly important that we've been working on, not just the survey, and we'll have some more results from the survey very soon, but also what we're doing on unintended consequences, both positive and negative, of the measures that we put in place around COVID. And that's work that my team and the BC CDC and others across the province are working on. And yes, we are using disaggregated data in that context, and one of the things that we've been working on that I will be presenting soon, hopefully next week, is some of the information from that work that informs our school situation, for example. Who's been most disadvantaged by the closing of classrooms, and how that affects communities across our province. So thank you for that question. It is a reminder that yes, we are working on it. Everything seems to take a lot longer than we hope.
Do you have a follow-up, Shannon?
I sure do. Dr. Henry, first of all, are you able to say when BC began collecting that kind of data? And then sort of a question to both of you. We've seen some disaggregated data released from other points in Canada. I'm thinking specifically of the city of Toronto. And it really highlighted that, you know, different communities, different groups are experiencing this pandemic very differently. Do you have concerns about the fact that BC doesn't seem to have any idea about how the pandemic is affecting different communities and how that will affect how we address those disparities going forward?
Yeah, well, we do have an idea about it. As I say, we've been analyzing that information, both from the survey and from the data linkages that we're doing around the unintended consequences. What we have not done is publicly reported on some of that yet, because it hasn't been in that form that's analyzed in a setting or a form that we can release publicly yet. So yes, we are working on it. We have looked at what's happened in the city of Toronto. You have to remember as well, there are way more cases in the city of Toronto than we've had across BC. So the differential impact is slightly different in our communities. But yes, we will be reporting on that soon.
The next question is from Penny Daflos, CTV.
Hi there. Thanks very much for taking my call. We've heard from parents, educators, and epidemiologists who have issues with the back-to-school plan, namely around the lack of mandatory masks, details of the enhanced cleaning plan, as well as obviously the size of cohorts. And today the Premier said that schools will be different in spring than when we started. So I'm just wondering, why not change your plans now and start the school year addressing many of those issues which are being handled differently in other provinces?
I'm not sure exactly what you're asking, but as we've said, this is a framework, and we've learned from what happened in June. We've learned some of the things that work and don't work, and every school is now doing that work of the detail. What does it mean for my school, my classroom, the children in this district? And so that is where we need to come together, all of us, to support that planning work that is going on now. And so, as we've said in the framework, it will look different in different schools, in different scenarios, different age groups. So a very large high school, for example, may have to have an online and a remote learning options as well as in-classroom options, because there's no physical way to make sure that we can keep those layers of protection in place. That's the work that is happening now.
Yeah, I think that Dr. Henry is one of the leaders in the country as provincial health officers work together on this question of schools. And just to repeat what I think Dr. Henry said very eloquently earlier, when the decision was made at spring break, which was March the 20th, to essentially stop in-class learning for a significant period. That was a very difficult decision to make, and we know, just as with the cancellation of surgeries, of elective surgeries, that it's a decision that had other consequences, health and otherwise, for the people who had to deal with it. And those included, of course, parents and teachers and people who work in schools, but principally the students themselves. It's why so much effort was made. Unlike other jurisdictions in Canada, if we want to compare across the country, to having the reopening that we did in June, and to have hundreds of thousands of children in BC back in classrooms based on the advice of public health officials who care passionately about their safety, and put in place measures designed to protect their safety while ensuring that they have the safety of being able to learn. And that is something we then learned to put forward a framework, and now we've got weeks to work on that to make sure that when students return to school in the fall, that they're safe and that they're able to learn. And that's the process we're going through. And I think people also forget that when we relaunched surgeries, we announced it much earlier than we actually started to perform elective surgeries. We spent months working on the issue of visitation and long-term care. And these are different issues, but they reflect the same methodical care that Dr. Henry and I think our whole team shows to all these issues. And it involves working with all of the partners to make sure that we get it right. We heard from the Hospital Employees Union and care home operators and people in the sector before we made those decisions, and the decisions themselves reflected that care. And then the actual decisions on the ground, the decisions and the strategy on those questions were of course put in place with, in the case of long-term care, about 560 different visitation plans that kept the same principles but reflected the differences that care homes have in terms of buildings, in terms of structures, in terms of residents. And so it's the same in public education. This is a methodical, thoughtful, serious process that involves all the players. The Minister of Education, the Ministry is working with all those players every day, in fact, this morning. And that's happening in every jurisdiction in the country. And so that approach, the thoughtful, methodical approach, where we work with people and we listen to people and we make changes based on the evidence, that's going to continue to be the approach. And that's more frustrating than saying I'm making the decision on one day and that's all it's going to be. But we have to put in place a framework that works. And then within that, it will be, of course, the responsibility of everybody in the system to make it work. And all I can tell you is my whole experience of these questions with our public health officials who have worked, especially work on the education in schools and on ensuring and protecting children against infection in schools, reflects their passion for that question and their passion and belief in the value of learning as well. And that's what's going to happen now. There's a lot of work to be done.
Follow-up, Penny?
Yeah, I guess my point is that there is a lot of frustration and confusion amongst parents who don't feel that they're being listened to, for example, and I'll just give you, one big sticking point that I hear again and again from parents and from teachers for that matter, is there's no way to keep children physically distanced in classrooms the way that they are right now with the furnishings, with the amount of space, for example. So knowing that now, we know that now, we don't need to wait for school to start again, and that seems to still not be sorted out, for example, through mandatory masks. And parents just want to know, why are these issues that they're bringing up right now, that they see being an issue today, August 6th, why isn't that being addressed in a way that they are satisfied and would feel safe with their children starting school weeks from now?
Well, I think that's a very good example of that people are thinking of the school that they left in March. It is different now, and teachers and educators and the people in the schools are looking at how they can, and we've seen it around the world. We've learned from other places. We learned from June. Yes, you can make a classroom safe. It means taking out lots of things that may have been in there before. It means thinking differently, and there's lots of innovation that is going into those things. So I would say to those teachers and parents who are concerned, connect with your school district, connect with your teachers and your school, because those are the things that are happening right now as how to make those things work. And there's no jurisdiction in this province or in this country that is looking at having young children wear masks all the time. That's not an answer, and it's not what's going to protect kids in schools. It's the layers of things that we're doing. And that includes everything from administrative things about timing of when kids go into the classes, timing of classes, keeping smaller groups together within the classroom. How do you keep smaller groups together as well? And we know that the classroom setting is a very controlled environment. We know who's going in. We know who's with each other every day. So those are things that we are learning. And so we have to think differently. We have to think differently, not think that it's going to be like what it was when we left in March. And those are, I've heard incredibly innovative things. We've seen it being done in many other sectors. We're seeing it being done now. So I would encourage parents and teachers who have not yet had that way of thinking to connect with their schools. And they will be hearing more from their schools in the coming weeks.
Thank you. The next question is from Mary Griffin, Check News. Mary, go ahead, please. Mary, are you there? Okay, moving on. The next question is from Andrea Ross, CBC.
Hi, Dr. Henry. You have consistently said your goal is to keep our COVID-19 outbreak low and slow in BC, but do the case numbers of the past few days still count as low and slow?
Yeah, obviously I would like them to be lower, and what we're doing is addressing the specific environments where we have seen transmission events happening. And, you know, as we mentioned earlier, the things that I'm worried about are cases that are appearing out of nowhere that aren't linked or connected. And so far, those have been very, very low. We're able to find people rapidly. We're able to connect people and connect the dots. What is concerning to me, and why we need to really focus on this concerning piece of people having larger private parties or going to multiple different smaller parties where they're with numbers of different people, that we're starting to see spill over into more concerning environments, like people who work in long-term care homes, or people who work in some of the essential services where there's other people that they come in contact with, people who work in corrections, for example. So we need to be careful that if we're a healthcare worker and we're going out to parties, we need to keep our bubbles small. This is not the time to start expanding widely for those types of community contacts. So that's where we're seeing some of this transmission happening, where people are going to parties in enclosed environments and they're spending time with people for prolonged periods of time, talking, laughing, singing, sharing drinks and other things. And that's where transmission is happening right now.
Follow-up, Andrea?
Yeah, regarding the COVID Alert app, does BC plan to implement it? And if so, when? And if not, why not? And if it's also possible to get an answer in French?
Sure, and we've been involved from the very beginning when the provinces and territories and the federal government have been looking at options around apps and where they might be useful. As I have said many, many times, it's bread and butter of public health to do contact tracing. And when you're somebody who has been exposed to this virus, there's so much unknown about it, you need somebody to tell you what the issues are, what your risk of exposure is, what we need you to do, and there's nothing, there's no electronic magic bullet that can take that away. So we are supportive of having a single app in Canada, and this is the one that has been chosen, the federal app, and we've been working with them to see how we can tailor it to be a tool that supports the work that we're doing in contact tracing. And I think there's some really great opportunities for that. You know, I look at some of the parties that we're hearing about, people going into nightclubs, and where you are in settings where you might not know everybody there, where we have in BC have an order that you are required to take contact information, but understandably perhaps in some situations not everybody gives accurate contact information. So I can see this app being supportive of us being able to say, okay, if I'm interviewing somebody who's a case and I know that they went to this nightclub last Friday between 9 and 3 in the morning, I can use the app, make sure that the nightclub requires anybody who comes in to download the app, and then we can use that to notify people who are also at that place at that time. So these are the types of things we're working with the federal government on. So right now it's only available in Ontario, and Ontario is tweaking it, and we've been working with them on that as well to see if it will meet our needs as well. So I'm not sure the timing, but we're hopeful that it will be something that we'll be able to use to supplement and support our contact tracing.
Nous travaillons, en fait, nous avons travaillé depuis le commencement de cet effort de trouver une app pour tout le Canada, avec le gouvernement fédéral, avec des autres provinces. Et maintenant, on fait une expérience sur l'app fédérale dans la province de l'Ontario, et on va apprendre beaucoup, je pense, de cet effort, de cette expérience là-bas. Nous avons l'intention d'utiliser cette application, mais ça va dépendre, on veut que ce soit utile, c'est-à-dire que cela augmente nos efforts, et c'est pour cette raison qu'on est en train de travailler à fond sur ces questions avec nos partenaires dans les autres provinces et avec le gouvernement fédéral, pour qu'on puisse réussir, et cela peut ajouter aux efforts essentiels des êtres humains qui font ce travail quotidiennement.
Thank you, and we have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released this afternoon. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And the last question today goes to Keith Baldry. Keith, go ahead, please.
Hi, Dr. Henry, Minister Dix, thanks for this. Just want to go back to a point Minister Dix made about the shifting demographics of who's getting this virus. Been tracking the ages consistently, and the people under 40 were tracking around 20%, 25% for the longest period of time. And recently, those numbers have really skyrocketed. With the last 200 cases, 66% were under 40, and the biggest increase for age group is 20 to 29, more than any other group. What can we infer from this? Is it the fact that our care homes are under better control, but is also evidence that people in that age group are partying and potentially paying the price?
Yeah, I think it's a little bit of both those things. One is, the age group reflects the initial parts of our pandemic, which were very much focused in long-term care. So it reflected not only the residents who were affected, but also healthcare workers, which tend to be in our 30s and 40s and 50s. We're now seeing a shift, as you say, to a younger demographic. We've seen that across the country and in Europe and other places as well. And that is a combination of younger people getting together in the summer and going and some of the partying that we have seen, yes, but it's also the demographic of the businesses that are opening up. So restaurants, we know that it's younger people who are servers in restaurants and bars. Some of the other retail outlets where younger people work in those settings as well. Some of the bigger outbreaks that we've had in some of the blueberry packing plant, for example, also a younger demographic. So it's a combination of things.
Do you have a follow-up, Keith?
Yes, if I could. When you released the numbers on Tuesday, I guess the 146 numbers, I understand that included a number of people who were at a party in Vancouver Coastal. Do you have any more information on that particular event? And is there any estimate on how many people, as a result of that, are now in self-isolation?
Yeah, so the last numbers I heard were it was up to 45 or 46 people who were associated with a party, and it seems to be that there are overlapping social groups that have been to a number of parties, similar to what we saw, slightly different from what happened in the interior, but a similar concept. So those numbers are reflected not only in Vancouver Coastal, but also many people who live in the Fraser Health region. So it's back and forth, and the numbers of contacts related to that are in the 400 range. So we do know that some of these, even though they may have been smaller individual parties, the overlapping groups meant that there's a large number of people who were potentially exposed. So that's our warning right now, is that's where we're seeing the virus get a chance to transmit to potentially large numbers of people. So of the 1,500 and some people who are in quarantine right now because they've been exposed, a good proportion of them are related to those types of social settings.
Thank you, and that's all the time we have this afternoon. Thank you all for joining.
Thank you.